Let me begin by thanking my good friend Cory Ferrier for joining me. Cory has been with Adventist Health System in California since 2002, where he currently serves as executive of business development. I really got to know Cory back, and a big part of his responsibility was physician recruitment. I had a great time seeing Cory a few weeks ago before the stay-at-home orders began. We had a good time. We took in a game together, and we're unsure how things were going to fall out. Well, so here we are. I'm so glad I was able to meet with Cory, and the fact that we became friends made it even better. He's one of the kindest, nicest guys you will ever meet, and he's always there to go out of his way to help others. So, Cory, thank you so much for joining me. How are things with you, your family, and friends right now?
Oh man, thanks for having me. Really appreciate it. It's good actually to see your face, even though it's through this tiny little screen. Everybody's good. All my friends, family, close colleagues, for the most part, everybody's relatively healthy and staying out of trouble.
How has life changed for you since I saw you in LA?
Oh, dramatically. Um, I've never seen the city skyline so clear. The smog is gone. The beaches are clear. A lot of businesses, I think, one of the things that's been interesting here is I think a lot of businesses voluntarily shut down, even when we were contemplating the mandatory shutdown here in California. And it's just eerie, man. My commute in the morning takes about 4 minutes, I think.
So if we went to the arena tonight, it'd be a little quicker drive, right?
Oh man, much quicker. I think was it 7 miles we were going, and it took an hour and 10 minutes or something like that.
Yeah, gotta love LA traffic. That's perfect. So even though you're not a physician, tell me, how are you feeling physically, emotionally, professionally?
Uh, that's a good question. I think there's a lot of uncertainty. Whether you're looking at this from the pandemic standpoint of wondering if a surge is going to hit your particular hospital, whether you're looking at this from an economical standpoint with your friends and family who are potentially losing their jobs and getting laid off. I think the word that best categorizes everything for me is uncertainty and wondering what life looks like on the other end of this.
As you know, this has obviously been a crazy couple of months, and there's been so much focus on New York City and the prediction that LA would become just as bad, if not worse. So why do you think those predictions were so far off?
Honestly, I don't think the predictions themselves were so far off, because I think what you do in science is you learn from the data and make adjustments. And I think the stay-at-home orders and the social distancing and people here in California not being crammed on top of each other, whereas it is in metropolitan New York. I think that the social distancing tactics really mitigated the effects of having a high volume at one time coming into our hospitals. And so I see it as if we had done nothing, I think we would have been probably worse than what New York had or currently has. To me, I just think you got to learn from the data, implement the practices that we know make a difference, and then keep moving forward. So it'll be curious to see what life looks like for the next couple of months. That would be my best guess.
Yeah, it's so hard to predict. It really is. So I know your life has changed over the last couple of weeks, and have you moved into something specific that you do constantly, or does it change day to day what they need you to do to help out, or give us an idea of what your regimen looks like?
Yeah, I think every day is a little different. I think when this first hit, we were trying to data gather and information gather as much as we could so that we could be prepared. And so it was procuring supplies. It was looking at our staffing pools. It was looking at our processes in place to be able to handle a potential surge. And as you know, the original predictions were much higher than what we're currently at right now. And so we had to look at a 50% bed increase capacity for our hospital. Um, I think we've gotten through that point to where we have most everything implemented. We have a daily incident command with a few select individuals here at the hospital and leadership And then we follow it up with a leadership call twice a week to inform our entire leadership team of the changes and policies that we're making. And then also I have the support of being part of a 22 hospital system. And so there's a lot of good information coming from our system incident command. I think right now is we've done most of the preparation and planning for this, for any potential surge or influx of patients. I think right now it's just the waiting game and trying to mitigate the financial damages that we're going through currently, so that we can come out on the other end.
Well, last time we spoke, I think you just had to check yourself into like one of the most beautiful Marriott courtyards or something like that. Are you still having to separate yourself from loved ones, or how's that going?
I am. I would say out of an abundance of caution, I'm still doing that. The last thing I want to do is potentially, even if I'm asymptomatic, put anybody else at risk. And so really I'm trying to limit myself between the hotel and the hospital.
Sounds wise. um, as you know, you and I both are very close with a lot of physicians, and I've spoken with several physicians already in this little series that we're doing. And it's so interesting to see them and just see the difference in their faces. I mean, literally from a few weeks ago when I had actually spent time with many of them, to see how they look and how they're reacting. What have you observed, with the people that you're close to? You're close to so many doctors that you've worked with and recruited over the years. How do you feel their state of mind is right now?
I think it goes back to my original word, which was uncertainty. And you know me very well, and I'm always going to put a positive spin on it. And one of the things that I have seen from our physicians is just the creativity, the ingenuity of tackling a problem, something that most of us have never gone through in our careers. And a couple of examples are: I had no idea how many of our physicians had 3D printers at home. And when we first started getting word that we were going to be short on ventilators and negative air pressure rooms, that intubation, because of the aerosolizing nature of the procedure, it could potentially put a lot of providers in a room at risk in the OR or at the bedside. They started getting creative, and there was a lot of sharing between these creative physicians. And so we were putting together intubation kits made from the 3D printer so that you could protect everyone who is at the bedside procedure, yet the physician could still see clearly. We had to MacGyver some rooms to create negative air pressure so that I could increase the isolation units and put potential PUIs or persons under investigation and or potential COVID positive. So to me, I think that's given them a positive aspect to focus on. And then, of course, the other aspect is a lot of the physicians, like let's say orthopedics, for example, that deal in generally elective procedures and scheduled in advance. I think they're nervous. It's a complete standstill on those right now, and we don't have really any indication of how soon we'll be able to get up and going. And for a group doesn't have the backing of a major health system, there's a lot of nervousness on that.
Well, a lot of people don't know about you that let me figure out how to phrase this. I wouldn't say that you're short in stature, but you have many friends who are unbelievably tall in stature. You have many basketball friends in the world, and you did a couple of creative things and got them to do some shout outs. How did you get them to do that? Just out of curiosity. He's a big Lakers fan, by the way.
Oh man, I think that just goes back to my personality of stay networked with people that you come across in your life, and I've had the blessing of being able to see a few of my friends actually make the NBA, and so I reached out to a couple of them on Doctor's Day. So we couldn't celebrate traditionally this year on March 30th to recognize our providers, and so we had to get creative. So I just reached out to them and said, "Hey, would you mind making a quick video?" And just thanking the providers and what they're doing by putting themselves on the front lines. And we got a really good response on that. And so I actually stitched it all together on my iPhone, if you can believe it, and then slapped our hospital logo on it. But very well received.
That was really cool. Good job. Let me ask you, I spoke to our friend Gene the other day, and he had said that for the most part, they felt that they got things going early enough so they were able to feel that they had enough equipment and enough PPE and so forth. Adventist is a huge system throughout the state of California specifically. Did you guys have the same feeling? Do you feel that you got in front of it quickly enough, that you've got enough equipment, everything you need?
That's one of the benefits of being part of a huge system is you're not trying to compete against everybody else. You have the leverage of multiple hospitals. And really, that's the benefit of an incident command center, especially a centralized one. We practice each year dealing with potential emergencies, whether it's an influx of patients from an earthquake or a mass shooting. And I think it's one of the things that's almost like a textbook. You open the textbook and say, okay, here's the first thing I'm looking at. What are my supply levels? How do I procure more? And again, having the resources of a system and somebody who's overseeing that for again, the whole hospitals in California is a huge benefit to us. And so I feel adequately prepared. And if you were to ask any of our providers or any of our leadership or any of our frontline staff, I feel that they would say the same thing.
Do you feel that the city and the local government and everything is still taking this seriously and still adhering to social distancing, or do you feel that it's lazy at this point, or do you think it's still pretty tight?
I think it's still pretty tight. In fact, literally an hour before this phone call, we just got an extension on our stay-at-home order for Ventura County. So I'm now May 15th, which is a whole nother month of putting in place the tactics that we know help mitigate this pandemic. This is one of the nice things. I think a lot of our government, especially here in California, are relying on health leaders and physicians and people who are on the front lines trying to deal with this challenge versus telling us what to do. We're included as part of the table. And I think that makes a huge difference, not to compare against other states here in the in our USA, but I think California has done a great job of quickly putting a stay-at-home order and then basically mandating it so that our residents know how serious this potentially could be if we were to not listen to the recommendations from our CDC or World Health Organization.
Yeah, and that's interesting. That kind of leads into my next question, because I felt that all along. It seems like it's like y'all have done a really good job. And then but on national news, you hear snippets of different places, right? So the next thing I hear is that Governor Newsom is considering options to start slowly relaxing some of the stay in place guidelines, trying to get business regenerated and things like that, which I can understand, but it seems like that might be conflicting with the additional stay home order. What do you think about that?
I think it's still too preliminary to make any decisions. We heard that yesterday that the governor worked with, I believe, Oregon and Washington State to try to figure out what it would look like to do a slow ramp up to reopen. In fact, right after this call, I believe is the press conference that we're having here in California to get a little bit more details on that. My thoughts are it's still going to be at least a month out, and it's going to be in areas where there's not hot spots. It's going to be very systematic in what services. I don't think it's going to be a free-for-all right from day one and we're all going to be off at Nobu having sushi together. I think it's going to be very controlled and very controlled and very tightly controlled process moving forward.
Well, I am a little disappointed about Nobu, but we'll get there eventually. It's and you guys are in such a cool area. You've got so many scientific hot spots and hotbeds there. I thought I heard the other day they were talking about working on some antibodies, and they're testing people with finger pricks with a guy from USC, a guy from UCLA. Have you heard much about that, or what the plan on that is?
I'm so glad you're asking the business development executive on clinical research, because my CMO would be very proud. No, I really haven't. And I think it's way too early to be looking at that stuff. It's going to be interesting to see what comes down the next few months. I mean, whether it's a vaccination or whether it's looking at immunity through the antibody testing. It's just curious. And it reminds me, Stanford is actually doing a study right now where they think that part of the reason why California wasn't hit as hard is they think that some variation of COVID came through here a little bit sooner. And they're wondering if we have some type of resistance or immunity built up to it. And so they're testing that theory right now. my own personal opinion, I don't know. I find that hard to believe, especially since I didn't have abnormal sick calls from my healthcare side. And if we're the ones providing hands-on care, you would think that we would have been hit a little bit harder than most. So I just think it's so preliminary for any of this stuff that we have no idea what it all means yet, especially the business development executive.
Well, I knew you were a closet research guy, though. um, Listen, how about the docs on the front line, the pulmonology people, the ED? I know you're still in contact with those people, the nursing staff. How are they feeling? Are they just drained? I mean, when I see pictures of these poor people on the news, it's just heart-wrenching to see them. That looks like they almost look like they're void of hope.
To be honest, I don't feel that here locally. And again, I think it has to do with we haven't had a patient surge that we couldn't even remotely handle. And to me, I think everyone's just spent so much time on prepping it and being prepared for that potential surge that we're waiting for it. I still see generally positivity in all of our providers and our staff. In fact, right before this, about an hour ago, I walked through two of our specific units just to see how everybody's doing. And to put it mildly, the census is really low, so I had a chance to talk with everybody. And I would say that most people are pretty positive. Everyone just has the same questions you and I have, which is, when is this going to end and what does that look like afterwards?
Do you think that's the hardest part of being a doctor in this pandemic right now, is they just don't know when it's going to end?
Yeah, especially for the ones not working. I have surgeons who are looking and asking other physicians who actually are busy during this time, can I assist you in your case? And I think that's the hardest part for everybody is when you're used to being in a 24/7 busy environment and always having something available. I just think this takes a step back for some individuals. And I'll give you a quick example for me. I mean, you know me, I live here at the hospital. And yesterday, I think I only put in, it was about 9.5 hours. And my CEO called me and just said, "Hey, where'd you go?" And I was like, "Oh, I went home." And I realized, and I was just like, man, why does it feel like I'm such a slacker when I worked a half day, yet I put in 9.5 hours? So it's just a weird time, man.
Sounds like it. So what do you think the crystal ball a couple years ago would have done for us? Do you think it would have changed how we would have prepared for things personally, professionally? Do you think it'll change the way we look at things going forward in preparation when someday this will happen again?
Yeah, yeah. I hate to venture and guess what's going to happen in politics and the mandates that they put on hospitals as a result of this. But I think like you said, you look into the crystal ball. I think one of the things it would just be interesting how quickly we could access those supplies and resources, both from a state and federal government. And how much we have on hand. I mean, I think that was one of the hardest things initially was you're competing with all these hospitals trying to get enough masks and protective personal equipment for your frontline providers to be safe, to be able to handle the influx of COVID patients. So, and we were scrambling a little bit, it felt like. Right now, it's a totally different situation. As a system, again, we feel very prepared. But I think, you have to learn from every situation. And for me, that's one of the things that I took away from this personally.
As you know, right now, it's virtually impossible to really recruit a physician. We're talking to physicians all the time, but it's very difficult to figure out the best way to get this happening because nobody can travel. So once these restrictions lift and business starts getting back to normal and you start doing elective surgeries and things like that are still going to happen, babies are born, it's all going to get back to normal. Do you see this changing the strategy and recruitment going forward, or do you think you'll have to get back to your med staff plan as quickly as you can?
Um, so there's two parts to that question. I want to address the first one, which is recruitment is kind of on standby. And this is your wheelhouse, and I've learned a lot from you over the years. And one of the things that I think I've really learned is whenever there's a change or a shift or a disaster, that's where the most opportunity is. It's interesting because I feel like right now is why we may not be able to send a contract to a physician I absolutely can be talking to them, telling them how important they are to my system, sending them a care package to make sure them and their families are safe, checking in with them weekly, whether it's Skype, Zoom, FaceTime, just making sure they're feeling connected to my system to let them know as soon as this settles, we expect to be able to employ you and make an offer. And I think that sets us apart from some other systems right now who are kind of sitting and waiting for this to release. Guess what? When they release the mandate and things kind of go back to normal, they're going to be 10 yards behind me, unfortunately, and I'm going to get to pick who I want. So that's the first aspect. I would say, again, I learned that from you, which is communication piece, always keeping in touch with them. The second piece is the landscape look different from here? I don't see how it couldn't look different. I think with the relaxation of the rules for telehealth visits, I think you're going to see a lot more virtual visits versus coming to the big box healthcare provider. One of the interesting anecdotes, so not scientific, but one of the things that we've seen is in the drop in our ER volume, we've actually seen an acuity increase in our ER volume. So the percentage of patients we admit from the ER is much higher than what we normally do, which tells you previously the type of patients you're seeing, you could have maybe gone to their primary care and urgent care setting. I think that's going to be a unintended consequence of this whole pandemic, and the fact that people may think twice about how they visit with their physician. And then with the tools of having telehealth medicine visits available, that's going to be interesting. I think another big thing that may change, again, this is just, me personally, I think there's going to be a move away from fee-for-service to more capitation, because it's interesting to see which physicians are going to be come out on the other end of this, especially with depending how long this lasts. So I don't know, just a lot of stuff is going to change, Tony, is what I'm trying to say.
That's great observation. You're the first one who's kind of gone down that path. That's really interesting. I like the thought. Obviously this is putting stress on businesses, large and small. No matter who we are, hospital systems are no different. Do you feel like systems are kind of like, okay, we're gonna take it. We're gonna take it financially. We just need to put our heads down, get through this acute situation. We'll come out on the other side, then we'll see what we have to do. Do you think that's kind of where systems are at this point?
Yeah, it's a tough question to answer, because the financial hit that most hospitals are incurring right now is not something that we can do for very long. There's been some federal funds which will help mitigate a small fraction of what we're seeing, but it will be interesting. I think the ones, unfortunately, that are going to get hit the hardest are your rural health hospitals and your standalone hospitals that haven't joined big systems. And then for those to get hit, I don't think is good for the overall healthcare environment. I like a little bit more variety and option and choice versus having to go to 1, 2, or 3 big conglomerates. And so it's just going to be really interesting if and how most people can pull out of this. My main concern is for my independent physician primary care clinics. And, half of them have probably already gone to get one of the government loans that were available in that first weekend that got passed. And so I know a few of them that have received it already. And hopefully that sustains them for a little bit to be able to get again to the other side where we start lifting and start slowly bringing back some of these elective cases and outpatient testing.
Yeah, I anticipate this is going to drive the amount of employed physicians even higher than it had before. And I thought we had already seen such a dramatic rise, but it wouldn't surprise me. It makes you stop and think, that's for sure.
Yep.
Last thing is, I hear a lot of people who aren't on the front lines and don't feel that they're out there being able to physically do anything, or maybe putting themselves in harm's way, so to speak, but they're saying, what can I do to help? What can I do? What would you say to those people when they ask you?
Such a good question. So the first thing is stay home, please, because that is proven to be working. The second thing is, if you have to leave the house for an essential item, groceries, etc., to wear a mask, not for protection from others, but to protect others from you, because we know that's how it's transmitted. Using proper hand hygiene. Those are all the basics. I just have to reiterate that since I'm in the healthcare field. The other thing is right now we're facing a blood shortage. And so if you're healthy and you can find a safe environment in your area, I know the American Red Cross and a couple of services are desperately needing blood. And so we're actually having a blood drive at my hospital in about a week and a half, I believe. And so we plan to participate in that. But that's something that anybody can do. And you just go through a simple questionnaire. And so everything else just goes and reiterates back to my original point, which is Tony, stay home.
That's a great point. Well, listen, my friend, I miss you, and I'm looking forward to getting together again. Hopefully we can knock the golf ball around before too long
No,
and get back to some normalcy. But thank you so much again for taking the time. I really appreciate it.
no, thank you for having me. And I look forward to that. And I'll give you a couple extra strokes.